All right, so for quarterbacks and throwing athletes, very obviously the most common type of injury is injury to the shoulder, injury to the elbow, and in some cases injury to the hand or the wrist. But to focus in on the shoulder and the elbow aspect, the first thing that we need to consider is the body position and how we're able to take contact. So most shoulder injuries for quarterbacks specifically occur either due to contact from another player as they're going through their throwing motion, or due to falling into the ground in a bad position. So with this, what we want to consider is that the shoulder has the most range of motion of any joint in the body, and with a large amount of range of motion comes a great responsibility to be able to protect or preserve that range of motion. So it's not that we necessarily need to emphasize getting strong just for the sake of getting strong. We need to emphasize getting strong for the sake of protecting a joint that has a lot of freedom of movement and goes through a lot of high velocity actions through that range of motion. This really comes down to the rotator cuff and the labrum. The rotator cuff is a group of 4 muscles that sits mostly on the back side of the shoulder and help to provide stability and strength for the shoulder. The second aspect is the labrum, which is a fibrous ring that sits on the inside of the shoulder capsule and basically acts as a suction cup to keep the arm bone or the humerus intact with the shoulder. Between these two areas, we can do a lot of work to prevent or preserve the opportunity for injury.